This is The Voice of Aging, hosted by Brynne Malone, owner of Aging Solutions. Real talk, expert advice, and trusted resources to help you navigate aging with confidence, clarity, and peace of mind. Welcome to another edition of The Voice of Aging. I'm Brynne Malone, the owner and founder of Aging Solutions. Today's a big day at The Voice of Aging because we're going to talk about Medicare. And Medicare is an insurance product that is misunderstood, but we all need to have it if we're lucky enough to have 65 turns around the sun. So today I'm happy to introduce to you Dawn Cherry, who is a Medicare broker. And she's going to tell us what a broker is versus maybe an agent. And she's going to just spend the next few minutes to a couple hours with us, maybe.
Whatever you need.
Bring in to us all things Medicare. So I have a million questions. I'm sure you do too as the audience. And hopefully we get some really clear understanding about Medicare. And soon the term open enrollment, you might hear that, will be upon us. And this is a great time to be able to sit down and talk with a Medicare expert like Dawn. She's been in the Medicare space since 2012. She has about 60 agents working for her right now, or with her. So they form a great team to really serve the public. So we're going to learn about all these things and what's involved for Medicare. And so, Dawn, thank you so much for being here. Welcome to The Voice of Aging.
Thank you.
Thank you. So tell us, you've been doing this for about 14 years. What got you into wanting to be a Medicare provider agent?
I had been in real estate for 14 years.
Okay.
I was going through a divorce and losing my health care coverage and my life insurance.
Okay.
So I made an appointment to speak with an agent, and he was running late, so the manager started the appointment and did the fact-finding. What brings you here today? So I explained, and he said, sounds like you're hitting the reset button on your life. Have you thought about a new career? And I said, no.
I'm doing just fine.
Right.
Yeah.
He asked the right questions, and I was intrigued, and we had a couple more meetings. So I started out doing life insurance, disability, long-term care, and Medicare supplement. And I really felt like Medicare was the most complicated part of the life and health world. And I started running those Medicare appointments, and I fell in love with the clientele. So it's my calling. I love everything about it. So I left, it was Mutual of Omaha, I left there and opened a brokerage because if I was going to work with Medicare eligibles, I needed to be able to offer them everything, not just the one product line that they had to offer.
So we'll dive into that a little bit, the Medicare eligibles. I want to jump on that first. Who is qualified, or who is a Medicare eligible?
So you mentioned 65. It is 65 and older.
Okay.
It is people that have been on Social Security disability income for 24 months are automatically put onto Medicare. And then a few other instances like ALS or those on kidney dialysis. There's some exception rules.
So they have exceptional chronic diseases or something like that. Right?
Yep.
You can go on Medicare early.
Yes.
Okay.
Yes.
Okay. But for most of us, it's going to be 65.
Correct.
Right? Okay. So my birthday, let's just say my birthday is April 1st, and I'm 65, so I come to you and I say, okay, Dawn, okay, so I say my birthday is on April 1st, and I just turned 65, so I come into your office, right? I'm 65.
Hopefully you're coming in before you turn 65.
Why is that, Dawn?
We really need to start planning 6 months before.
6 months?
6 months before your Medicare
But I'm only
eligible.
64 and a half at that point.
That's right. But there's a lot of steps in there, and they vary depending on your situation. So if a person's going to be collecting Social Security 4 months before their 65th birthday, which you can start to collect at 62, then you're automatically put on Medicare. If you are not collecting Social Security, the federal government is going to assume that you're remaining on an employer plan. And so you have to take the steps to enroll. And then you have all of those people that choose to work past 65 that are on creditable coverage through their employer that don't need to take Medicare. And then that's a different type of application when they get that far. So we need to have those planning conversations ahead of time so nothing's falling through the cracks.
Okay, so you said a lot right in there. I'm going to just slow it down just a little bit.
Yeah.
So if I can retire and collect Social Security at 62, but I'm going to get penalized for that, right?
You are only going to, it's not really a penalty, but if you continue to work and earn income before your full retirement age, they're going to pull back some of those Social Security dollars.
Okay.
So that's a conversation we can have.
So that's a conversation you can have. And can you pull up Social Security, my Social Security, you know, because I have an online Social Security?
No, because of privacy, we don't have access to that. Right.
So I need to know that before I come to see you.
Yep.
All right. So if I'm going to come see a Medicare person that's going to assist me, I need to kind of know where I stand with my Social Security.
Correct.
Is that accurate?
A lot of our initial conversations are fact-finding. Okay. Everyone's starting out at a different place.
Yeah.
Their needs are different. So it's, you know, I have people that walk in and say, I turned 65 last week. I think I should do something. So you're kind of behind the 8 ball, and you just work with that.
So what happens if I already turned 65?
You have 3 months before your 65th birthday, the month of your 65th birthday, and 3 months after.
Okay.
Which is your IEP, or initial enrollment period.
Okay.
You're guaranteed to get into a product. The caveat is if you're born on the 1st, then your Medicare is going to start the 1st of the previous month. So again,
so I'm April 1st. When's my Medicare going to start?
March.
Really?
March 1st. Yes.
What if I'm April 15th?
April 1st.
April 1st.
Yes.
Okay.
Yeah.
That's interesting. All right. So we've got that down. Yes. So you're telling me to prepare 4 to 6 months in advance.
Yes.
And I'm going to come and see you. And you're going to do a lot of fact-finding through questions about my employment history, what I'm going to do with Social Security, have I researched my Social Security benefit, all those kind of questions, right? Okay. And then you're going to ask me about my employment status. And I'm going to say, well, I don't ever want to retire, right?
So we're going to look at what you currently have through your employer.
Okay.
And see what makes more sense for you. Do you remain on the employer plan, or do you go on to Medicare? Then, to make it more complicated, if it's a small employer group, under 20 employees, there's different rules than if it's a large employer group, over 20 employees. Oh. So those are conversations we have, because we don't want you to miss your enrollment period or to have a penalty for not enrolling when you should.
Okay, so Don, I have to stop you right there. We've only been talking for 7 minutes, and I'm already confused. Yeah. I feel like we're going to be here all day.
We could.
We could?
Yes.
Okay.
Yeah.
So if I'm with an employer that's 20 and under, there's a certain set of rules. An employer that's more than 20, 21 and over, there's a different set of rules as it relates to my, and is my HR team going to be able to tell me this, or should I really come and see a Medicare agent?
You should see a Medicare insurance specialist. Absolutely.
Okay. Well, I would think smaller employers like myself, we don't have the HR resources, right? We farm that out. Yep. So, okay, so I have that. Okay, so let's say a scenario here. I go on Medicare, but do I have to go on Medicare Part B if I'm still...
If you're still covered under that employer plan?
Yeah.
You do not. And if your coverage through your employer is creditable, meaning as good, if not better, than what Medicare sets the standard at, you can defer Part B.
Okay.
So you're not paying the premium for Part B. Your Part A, you're eligible for that at 65 by way of having worked 40 quarters or 10 years.
Okay. So you're going to explain to us what the A, B, C, and Ds are of Medicare, right?
Yeah.
Here, there you go.
Part A is inpatient hospital.
Okay, so if I get in an ambulance or I end up at the ER and I'm in the hospital.
If you're in the hospital in an inpatient status.
What does that mean?
So you could be at the hospital overnight having a hip replacement, and you could be outpatient status the entire time.
Well, what does that mean?
It's how they classify you while you're there.
Okay.
So if I'm having a hip replacement and I'm at the hospital and I have other conditions that might complicate things, they're probably going to make me an inpatient.
Okay.
However, nowadays, most hip replacements are outpatient status. So outpatient status and your other medical services like doctor, ambulance, urgent care, those are Part B.
Okay.
A is just that inpatient status.
So if I'm admitted to a hospital to have, let's say I have an infection, gosh forbid, I'm on IV antibiotics and, I'm septic and I'm going to get admitted. That means I'm sleeping there and they're feeding me breakfast, lunch, and dinner, right?
Right.
That's inpatient status. If I'm in there and I just do a quick turnout, and I don't have, I think they call it 2 overnights or 2 midnights, then that's outpatient status.
So the complicated thing about Medicare is for every answer, there's a but. So
There's a but?
There's a but.
For every answer?
Yes.
Okay.
So yes, however, if you are in the hospital and you are there for 3 full 24-hour periods and you're on Medicare and they did not put you as inpatient status and they then want to move you to a skilled nursing facility, Medicare will not cover that skilled nursing facility unless you were inpatient status for 3 full 24-hour periods.
Okay.
So there's rules like that we have conversations with the clients about.
Okay.
These are the things to look for. These are the things to be aware of.
Yeah. So the famous tagline that I've had over my career is, because I meet with families and advise on these issues, and they're like, well, we just don't know. We don't know. We didn't know. I mean, how would we know?
Right.
Right. You and I had that conversation prior to coming on air here, right?
You don't know what you don't know?
You don't know. Yeah. And there's so much that people don't know.
Yes.
Which is why we're doing this.
Yes.
Okay. So if I'm going in the old days, because I worked in the home health industry, you would go in and hip surgery was a guaranteed 3 days in the hospital, 2 to 4 weeks in the nursing home, which a lot of the nursing home are skilled nursing facilities. Right. They used to call them convalescent centers back when I was growing up. I just aged myself there, didn't I? But that's okay. They developed these beautiful therapy gyms to rehab hips and knees, as we said. And what I'm seeing now is a lot of folks just aren't spending the time in the rehab centers, and because the hips and knees, as you said, are doing outpatient, either in the orthopedic clinics themselves have their own surgery centers now, is what we're seeing, the trend in the Pacific Northwest, or the hospitals discharge you same day.
Yes.
Right?
Yep.
That's accurate.
You have a new knee, go hop on that stationary bike.
So when people say, well, I'm retired and I'm done, I don't have to do anything else because I am retired, I kick my feet up, I go fishing, play golf, do the garden, I always tell them, life is still happening around you. And you need to stay on track with that. I think that's a perfect example because, everyone's going to have to access medical care if they live long enough, right?
Right.
So I had a client once, he was an elderly gentleman in his late 80s, and he said, everyone thinks they're not going to need medical services, but I don't know anybody that hasn't needed medical services in my... Right. So it's important to be prepared.
Yes.
So we have the A, Medicare Part A, that's hospitalization. How many quarters do you have to have worked to qualify for
40 quarters or 10 years.
40 quarters or 10 years. Is that full-time or part-time?
That's full-time, at age 65. So there's a graduated scale for those that are on Social Security disability for having worked less quarters, depending on their age.
So they take into account the things that we talked about. And then so that covers hospital and skilled nursing. Does it cover any other benefits? Hospital, skilled nursing?
If you are put on hospice, regardless of what plan you're on, it will revert back to coverage by original Medicare.
Okay, perfect. Okay, so then we can move on to Part B.
Correct.
So we've got the A of the ABCD.
Yep.
Now we're going to go to B, and B is for?
Medical.
Medical.
Doctors.
Wasn't a hospital medical? I'm confused.
Outpatient.
Outpatient,
yes.
Okay.
Yes.
Okay. So.
And then doctor visits.
Okay.
MRIs, CT scans, emergency room, ambulance ride.
Wheelchairs.
Yes.
Stretches.
Yes.
Okay. Doctor visits, you said that. Specialists. Okay. So on Part A, how much can be covered on Part A? Like if I'm in the hospital for 3 days.
So part of the reason why original Medicare, which is your A and B, is not adequate coverage is if you only have a A and B, and you went into the hospital in an inpatient status, you'd have a $1,736 deductible every 60-day period.
Okay.
So if I went in this month and I went home and went back in 3 months, I'm triggering that deductible again.
I'm a frequent flyer. It's bad news for me. Okay.
Correct.
All right.
And on Part B, you're paying an annual deductible. These numbers vary by year.
Okay.
But then after the deductible, you're responsible for 20%. 20% of all medical with no cap.
Okay, so if I have a CT scan, which can be expensive,
Heaven
X-rays.
forbid you have chemotherapy, you're paying
what?
20% with no cap. And that's medical bankruptcy.
What if I go get iron infusions from time to time?
20%.
20%. Because iron infusions, I know are like $1,000. So that's $200 out of my pocket.
Chemo. Radiation. All those things fall under Part B and have that 20% exposure with no maximum out of pocket.
No maximum?
No.
Which means you can just keep spending depending upon your usage of or access to that.
Yep.
And then if you're having different specialists like, oncologists and hematologists and all that, if you're battling cancer,
yes,
that's kind of on top of that. So you're paying 20% of their bill also?
Yes. Okay.
And then, wow. So right out of pocket, am I paying anything for Medicare Part A?
Not by way of having worked those 40 quarters.
Okay.
For B for this year, you would pay $202.90.
And is that a federal thing or
yes.
state? Okay, federal. All right.
$202.90 per month.
$202.90.
But
there is
a thing called an IRMAA, income-related monthly adjusted amount. And so depending on your income level, you may pay more for Part B and more for Part D.
Is there a maximum I pay? So what you're saying is if my income levels, and I'm retired and I did well because I worked really hard all my life, and my income's $140,000 in retirement, I'm IRMAA'd?
So if you're a single individual, it's $109,000 for this year.
Okay.
To start up that scale.
Okay, so if I make $109,000 and I'm single, then I'm going to have to pay more than the $202.90.
Correct.
Okay.
And there's a graduated scale with 5 different levels depending on income. And that's a conversation we have too, because if you go on to Medicare and Social Security sends you your letter, says you're on Medicare, it'll say you'll be paying $202.90, and it'll take about 60 days for them to catch up with the IRS and all of that to determine your IRMAA. And your IRMAA has a 24-month look back.
Oh, so they can come back and capture that on me.
It is based on 2 years.
So then do I have to write them a check?
Nope. You're just paying more on the monthly amount.
Okay.
Yeah. But we like to eliminate the surprises. So if we can plan and have those discussions, here's a perfect example. I had a gentleman that could stay on an employer plan or go off onto Medicare. And when we looked at all things and we looked at that IRMAA because he had just sold a business, he stayed on his employer plan for 2 years so that IRMAA was...
Because the Part B IRMAA.
Correct.
I'm going to call it Part B IRMAA going forward. Okay.
Yeah.
Too much.
Yeah.
Okay. All right. So then we have Part C. Oh, wait a minute. I have a question about Part B.
Okay.
So I asked earlier, but I want to clarify this. So I have an employer. I'm still working. I'm 65. I decided to go on Medicare Part A, but I don't want to do B yet.
Just don't do anything.
Just don't do anything?
If you're not collecting Social Security, they're not automatically going to put you on B. And so you're just not applying for it.
Okay.
So then down the road, you're going to reach out to me at least 3 months before you're going to lose that employer coverage.
Okay.
So we can do the employment information form, which is your HR verifying that you had creditable coverage from the time you turned 65 so you don't have a penalty. And we're going to do the application for Part B.
So what if I was unemployed for 3 months during that time and I was looking for a job because my employer got bought out and they restructured or, gosh forbid, I got fired?
Sure. If there is a lapse of coverage in there, you will be paying a penalty.
I will?
For not having creditable drug coverage.
But it's not my fault. I didn't sell the company. I just got laid off.
You did not, but you were responsible to make sure you had coverage.
But who told me that?
I would have.
But maybe I didn't have you yet because I'm on,
I know.
I know. So have you run into that before?
Yes.
Okay. And are the people happy when they come to you and you tell them that you have how much is the penalty, by the way?
So an example would be the Part D drug penalty is 1% of the average cost of a plan. It's reassessed each year. So currently that's about 38 cents a month. So that's not a big deal, right? But that went into law in 2006. And today, if I met you and you went into Medicare in 2006 and you never had a drug plan because you said to yourself, why would I have a drug plan if I wasn't taking any medications?
Right, because I'm never going to get sick.
Right?
Yeah.
Exactly what you said. Exactly. So now I find out I need to take an insulin each month. That is $400.
Because I'm a type 2 diabetic?
Okay. And I'm going to go onto a drug plan and I'm going to pay approximately $70 a month in penalty.
What?
When that could, for the rest of my life, and that could have been avoided by having a conversation and making sure there was a drug plan in place.
Huh. So I'm going to pay an extra $70 a month. What if I don't have $70 a month? Do I have to do the
Then
drug
you will
plan?
not be able to have a drug plan, because whatever drug plan you go on to, when you have a late enrollment penalty, which is what that's called, the drug plan that you go on to is responsible for collecting that late enrollment penalty. So if you don't pay, they cancel you.
So who provides the drug plan? Is it
Private insurance companies.
private insurance companies? Okay. So I have all this coverage, but I'm thinking I'm on federal coverage, right, through Medicare, but it's not. I am,
Doesn't
and I'm.
include any
It's
drug
a but.
coverage.
It's a but,
Yes.
right? I am, but I'm not.
Yes.
So that's drug coverage. I think President Bush came up with the drug plan, the Part D.
06.
06. Okay.
Yep.
So on Part B, I'm paying a penalty as well if I didn't sign up appropriately, right?
You would be paying 10% penalty for every 12 months that you did not have it.
So, right, 10% on what, the monthly fee
Yep,
or the
monthly premium.
Okay, so that's, what is that, $20?
Yep.
At
However,
202?
I met a gentleman in my career that had no guidance, never took Part B, only had Part A, and 12 years later, after turning 65 and becoming eligible, he, because of his medical condition, needed medical coverage, needed Part B.
Because he's getting
And
treatment.
he's paying 120% in penalty on that monthly premium.
And he's 77 years old.
Yes.
Okay. So you can get penalized on B and D.
Yes.
B and D,
Yep.
you can get penalized. And it's not a small penalty
When it's accruing,
when it's accruing.
yes.
If you catch it right away.
Right.
But there's no one, potentially, someone's not going to inform you about that.
No.
Okay. So then what is Medicare Part C? We got A, B, and we went A, B, D, but now we got A, B. What's the C?
Medicare Advantage.
Advantage.
Private insurance company.
Okay.
Has to be as good, if not better, than original Medicare, A and B.
Okay.
So your red, white, and blue card.
Your red, white, and blue card. Yep.
And
That's a milestone for people, right?
Yes.
To get their white and blue card?
Yes.
Yeah.
and the plans vary. So we're doing a needs analysis. Who are your doctors? What prescriptions do you take? What benefits are important to you? Dental, vision, because those plans have those additional benefits that Medicare doesn't cover.
So you're telling me Medicare does not cover my eyeglasses, my hearing aids,
No,
or my teeth?
no.
Well, I have a brother that's a retired dentist, so that's out. So I'm stuck, right? So if I am on original Medicare, it's called original Medicare,
Yes.
the red, white, and blue card. Mm-hmm. How do I get coverage for those items?
We have that conversation. There are standalone vision policies. There's standalone dental policies.
What you're saying is if I pay an additional premium,
Correct. You can
That's
get
what I hear you
additional
saying.
coverage.
Okay.
Yes. However, on those Part C, the Medicare Advantage, some of them, and it varies by plan, includes cleaning exam, x-ray, fluoride. Some include some comprehensive dental. Some include some allowance for eyewear and a
Okay.
routine eye exam.
Okay. So, again, I think we're about 25 minutes into this thing, and I'm still confused.
Right.
I'd like to say I was less confused than when we started this conversation, but it's a little bit more confusing
Yes.
than that. I mean,
And that's absolutely what it is. What it is like for every Medicare beneficiary.
okay. So,
The deeper you dig, the more you realize it's complicated, and there's no way that you understand all the things that you have to take into account on your own. And then the plans change every year. So
what?
your Medicare Advantage plans, your Part D drug plans, they change every year. So we provide an annual review. We send out a form to you, you're filling that out, sending it back. We update your profile. October 1st, we can see the next year's plans. We do fact-finding just like we did with your initial appointment. If we feel like there is a fit that would be better for you for the upcoming year, we call. We have that discussion. If not, I send you a letter. We've done your review. Stay on the plan you're on for next year. And all year round, you call us for support.
Uh-huh.
You're not calling in 1-800.
Sounds like a kind of a weekly support basis thing going on here. If I want to go see my doctor, no offense to you, but it feels like I'm going to the dentist without Novocaine.
Right.
You know what I'm saying?
Yeah.
Yeah.
But you leave the office.
Feeling like I had Novocaine?
No.
Okay.
Feeling like you have an advocate.
All right.
You have someone to hold your hand through it. You have someone to make sure things aren't going to fall through the cracks.
Well, okay, so I want to trust you, but how do I know that you're trustable? Okay, so how do you know if they're changing everything all the time? How do you and your agent stay on top of that?
A lot of education. So this is the time of year when we start all of our certifications and credentialing to be licensed, contracted, certified for the upcoming year to represent those plans.
Okay.
To go through the benefits with you, to let you know how the plans work, to help you with the enrollment, to be able to contact the insurance company, to advocate for you.
Okay.
Perfect example is I just recently went through a denial for a prior authorization for a client to move from a hospital to a skilled nursing facility. So we guided the family on how to handle the appeals. The doctor did the first appeal and it was denied. We had the family do the second appeal and it was granted within 48 hours. So then we can also say, here's a list of the skilled nursing facilities that are contracted by your plan, and here's where you can go. So just those things, being able to pick up the phone and call us, makes a huge difference.
Invaluable.
Yeah.
So I ran into that with a client of mine who had a Medicare Advantage plan, and he was in a nursing home, and there was just some things that happened, and so in coordination with his Medicare rep in a neighboring state, we were able to, and a very, very, I will say the private insurance company we were working with did a great job, and we were able to make sure he was covered and not denied, because initially he was denied.
Yes.
And so we had to go through this process.
Yeah.
I don't know if the appeal process is that successful very often. I know I've done it with other of my clients, and I think you bring up a great point. Bring in the carrier, the private insurance company representative, which you are, right? If you provided that, and I think that has some clout.
Actually, we don't think of ourselves that way. We so have a team of over 60 agents, and they're highly trained, housed in Idaho and Washington. Contracted and licensed in over 30 states, because we do develop that trust and that close relationship with the clients, and when they move, we follow them so that we keep them.
So you keep them?
Yes. Okay. And we really look at ourselves as advocating for the client. That's and good. Standing in between the client and the insurance company, if you will.
Okay.
Because there needs to be someone helping them.
So you're advocating because you have the relationship with the insurance company, and you're saying, hey, listen, insurance company, this is our client. Well, we meet them at least once a year, and we provide for them.
And we have other means to accomplish challenges like that.
Okay.
They can come to me. I can go through the broker aspect of it and create an escalation, which goes through an escalation team. It doesn't go to member services. Yeah. So we have other ways to help navigate that. Yes. Yeah.
That's good information.
Yeah.
Yeah, because in anything we do anymore, we feel like we get, I'm going to use the term stonewalled a little bit, right?
Yes.
So it's great to know that.
Or how often are you told, go online?
Yeah.
Right? Or call customer service. You really want your own human being.
Or you're on hold, or you're talking to AI.
Yeah. And I probably should have mentioned this from the get-go. It is against federal law for us to charge a fee. So you're getting an advocate, you're getting the relationship and your own human being at no cost.
Well, how do you get paid then?
We're paid by the insurance company.
Because I know everyone's wondering that. You're paid by the insurance company. Right. Which with some people might say, well, if you're paid by the insurance company, aren't you working for the insurance company?
No.
But what you're saying, you're working for me, the consumer.
And the federal government has laws as far as what they can pay. So this is what your compensation for 2026 on, for this product is. So there's not a situation where one insurance company is trying to incentivize a broker over another. Okay. Which, as it should be.
So it's a level playing field from the incentives or the
Right.
brokerage fees, commissions, whatever people want to term them, or
Yes.
whatever they're familiar with, right?
Yes.
Okay. So you're not going to choose this insurance company because you're making extra commissions and you're not
Right.
being incented.
Which is why we are independent brokers,
Uh-huh.
meaning we contract with every carrier that allows brokers to participate.
Yeah.
That way, when you come to us and we do our fact finding, our sole job is to find the most appropriate fit for you.
Okay. So what's the difference between a broker and an agent?
Same term.
Okay.
Medicare has dual terms for everything.
Oh, they. Where's the but in that? But okay. So we go through this process, and you're helping me, and this is apparently to me, I'm a little slow on the uptick. We're going to have to meet once or twice at least. I mean, the first time I'm leaving there with my eyes glazed over, and I'm like, okay, I was pretty set on because my friend and my neighbor has this plan or policy.
Yes.
Right? And now I just went and I met with Dawn, and I'm a little bit more educated, but I heard a lot of things that I wasn't aware of, and then so now I'm more educated, but I'm more confused.
And we're able to show you the comparison process. So
Okay.
maybe based on your needs, there's a couple plans side by side, and we can show you both plans, what the strengths are, what the weaknesses are your doctors in network, are your prescriptions on formulary, all of those types of things to narrow it down.
So with my understanding with original Medicare is most doctors will take original Medicare.
Most, not all.
Yeah, let's
Yes.
just stay with the most for
Yes.
a minute. Okay. So, but that's not necessarily true with a Part C plan,
Correct.
right?
In most cases, you have to see providers that are contracted and
Okay.
facilities that are contracted with your plan. Those contracts can change. So that is,
So my doctor can change.
yes, your doctor can terminate that contract.
So then
Then
if I want to stay with my,
we may have to switch plans.
we may have to switch plans or switch doctors.
Correct. And we can help with both of those things, of
But
course.
if I'm on original Medicare, I'm just playing devil's advocate here. This
Yep.
is my job,
Yes.
So if I'm on original Medicare and my doctor, he's probably always going to be contracted with original Medicare if he is, but financially, is that good for me? We don't know, right?
So the difference there is if you want to have original Medicare remain as your primary coverage so that you're going to any doctor or facility that accepts original Medicare, then you're looking at having a supplement in secondary position to protect you from that 20%.
So a supplement's going to, it's called Medigap insurance, is that right?
Yep.
Okay.
Yeah. And then that doesn't cover drugs, remember, because original Medicare doesn't cover drugs.
I still got no drug coverage?
So we have Part D. Part D is a standalone prescription drug plan
Okay.
that you can pair with your supplement or Medigap. The difference is the supplement or the Medigap comes with a premium.
Another premium.
Another premium.
Premiums everywhere.
And there's several different supplements available. K and N, a G, all the different plans
Whatever
and parts,
plans.
right?
And
so
these are by insurance carriers.
private insurance companies.
Private insurance carrier.
Yes.
Okay.
And so depending on the plan you're looking at, which the G is the most popular, you are looking at in excess of $250 a month for a supplement. So when you're
and
already...
I'm still paying my 202?
You are.
90?
Because to have an Advantage plan or a supplement, you have to have A and B. So for some people, that's just not affordable.
That's like almost $500 a month.
It is. It is.
But now I still don't have drug coverage.
You would have a Part D plan, and we would look at that.
But I'm going to have to pay for that.
Some of them are zero premium.
But they may not cover my drug.
That's true. So that's why we have to look at it every year.
So that
More and more Americans are going on the Part C Advantage plan every year
why?
because of the affordability.
Okay.
We in Spokane County have several Advantage plans available that are zero premium. So when you're looking at a zero premium plan versus $250 a month, and that zero premium plan can cover things like dental and vision, give you those extra benefits, but you're paying co-pays for services. They're very different types of coverage, apples and oranges.
Okay.
And your need might not be the same 5 years from now as it is today. And when you're new to Medicare, that's when you're guaranteed issue, no medical questions, to either product, either type.
So
that's why
at 65, I can be a train wreck from a health standpoint.
And go on that supplement.
I can have diabetes and heart disease and cancer and everything,
all guaranteed
chronic
issue.
Kidney failure, and they can't deny me.
Correct. 65, or if you were working past 65, when you go on to
buys you more time.
Yes.
Okay. Yep. Well, the more we talk, the more complicated it gets.
Absolutely. There's no doubt. It's just, don't do it on your own. I plead with people. I meet people that are on original Medicare and didn't know any different.
Yeah.
I've had 2 clients that when I met them, they had already filed medical bankruptcy because they had no stop loss for that 20%.
Because they went on original Medicare.
And that was it.
Getting older is a gift. It means more mornings, more memories, more moments with the people you love. But it can also bring questions, uncertainty, and sometimes the feeling that you're navigating it all alone. That's exactly why Aging Solutions exists. Aging Solutions is a dedicated aging advisory service based right here in the Pacific Northwest. We walk beside you and your family with clarity, compassion, and practical support, helping you stay prepared, safe, and independent. Whether you're planning ahead for yourself or helping a parent navigate the road ahead, we are here for you. We believe no one should have to face these decisions alone, and with Aging Solutions, you never will. We offer 2 core services, each one designed to make life simpler, safer, and more confident. Our first service is your trusted aging advisor. Life comes with big decisions, and we help you make them with confidence. Through one-on-one phone and video calls, we work closely with you to build a personalized aging and lifestyle plan, wherever you are located. We guide you through the essential documents and advanced directives that protect your wishes. We help you think through long-term care and the real cost of aging, so there are no surprises. And when you need community resources or connections, we know exactly where to turn. Real guidance, real peace of mind. Our second service, currently only available in Spokane, Washington, is concierge support, because you should never have to navigate life or healthcare alone, whether it's a companion for an outing, a ride to your next appointment, help following up after a medical visit, or just someone to take you out to your favorite place. We are there. We can even help you with technology so you stay connected to the people who matter most. Think of us as an extra set of hands whenever you need them. We also offer 3 powerful products, all created to give you and your loved ones greater safety, security, and peace of mind at home. The Trinity EMS card puts critical information right in the hands of first responders instantly. Your treatment instructions, your medications, your emergency contacts, all secure and accessible when every second counts. It's one small card that can make an enormous difference. Trinity Connect is your daily safety check-in delivered right to your phone. Through calls or text messages, Trinity Connect checks in on you every day. If there's no response, your emergency contacts are notified, and if needed, so is 911. Someone is always checking on you. The Trinity Plan is your personal roadmap for whatever life brings. It organizes your legal, financial, medical, and personal information all in one place. It gives your loved ones clear guidance during a crisis or after a loss. Your wishes, your plan, their peace of mind. You deserve to age with confidence, dignity, and support. Aging Solutions is here, ready to walk beside you. Call us today or visit agingsolutionsnw.com to learn more, because every step forward is better together.
So you brought that up. I actually had a similar situation. I had somebody come to me, and they were on original Medicare, and they were a very high-powered attorney, actually, and the wife got cancer. And they spent a lot of money.
Yes.
And I'm like, well,
All avoidable.
all avoidable.
Yes.
So that's what I said. I said, you need to go talk to a Medicare person, and they're gonna show you on paper what your options are.
Yeah.
Right? Yeah.
At least improve the situation.
Yeah. So could that situation been improved? I did not follow up with them. I was actually working with their son, who's like, and I'm like, well, you chose the.
So all the buts, right? Most of the time you would have to wait until the annual enrollment period, October 15th through December 7th, which is coming up.
What else do they call that?
That is the annual enrollment period.
I call it the Medicare commercial season.
Oh my gosh, yes. Well, there's new federal laws in place, so you shouldn't see
as many
or as many
not every 3
deceptive.
seconds. Okay.
Yes. But that is the annual enrollment period where you can make a change for the next year on the drug plan or the Part C Advantage plan.
Okay.
Then there is the open enrollment period, which is January 1st through March 31st. People on an Advantage plan can make a one-time change.
Okay.
So I always use the example. If they made the mistake and called the phone number on the television commercial, and they put them on a plan without doing their due diligence, and then in January, they go to their physical therapy office and find out their physical therapist isn't contracted with the plan, or their copay just went from $20 to $50 a visit. We have a one-time way to fix that.
So what you're saying is I'm an open enrollment. That's what we call that, right? That's what I call it. And that's October.
That's annual enrollment.
That's annual enrollment. See, here we go.
October 15th through December 7th.
Annual enrollment. Why do people call it open enrollment?
Open enrollment is the January 1st through March 31st.
So the annual enrollment is October 15th
through December 7th.
December 7th, Pearl Harbor Day.
Yep.
Okay. And then I made a mistake. Ooh, boo. I was in a car accident, didn't know. I've got to go to therapy. My therapist is like, oh, did you change plans? And you're like, well, yeah, this one's better for me.
They told me so on the television or on the.
And they told me so on the phone. Yeah.
Yeah.
I knew the person because they were on a famous TV show, right?
Yes.
Yes.
Yeah.
So, because these are real life issues you and I are dealing with, right? Yep. Paid sponsors who are on there doing this kind of thing.
Right.
And then we find out. So then open enrollment is, give me the dates.
January 1.
January 1.
Through March 31st.
So I didn't celebrate too much on December 31st. I'm able to make a phone call on January 1.
Yes.
And I go through March 31st.
Yep.
To fix my O&O. All right. So that's kind of how you win and how you get signed up. The other question is, April 1st, I just signed up. Okay, now I'm done for a year, right? I don't have to sign up again until my birthday.
If you were on an Advantage plan, you would have the first 3 months. It's called your initial open enrollment period.
Oh.
First 3 months on an Advantage plan to make a one-time change.
Okay.
And then you would be on that plan for the rest of the year.
That's my January 1st, my March 31st, but in this case it would be April 1st to May,
June 30th.
June 30th.
Yeah.
Okay.
Yeah.
So I got through that and I'm like, all right, life's good. And then I'm done until
October 15th through December 7th.
I got to do this all over again?
Every year.
Well, wait a minute. I just signed up.
Because the plans change. Plans change. Well, and maybe you didn't change, your medications didn't change, your doctors didn't change, but maybe your plan changed and your expensive medication isn't on their list of covered drugs any longer. Or your doctor's not in network any longer. If we do that review during that annual enrollment period time.
So I should call my doctor and say, can I get all my expensive medications, issued right now?
Yeah, they probably won't do that.
Probably won't do that,
yeah.
No. It's always worth it.
Right.
They're not going to do it. Okay. So then what happens on, I go through the annual enrollment.
Make a change if we need to.
Okay.
And then on January 1st, it starts over again.
But how am I going to know? When can the doctors change their mind about whether they're going to take a particular insurance coverage?
That is a challenging piece. So when there is a contract, it doesn't run January 1st through December 31st between a doctor and a
That was my next
carrier.
question. Yeah.
So you may get a letter that the contract between your provider and your insurance company is ending on April 30th. And if they don't come to an agreement.
Well, this reminds me of, every once in a while you get scrolled across the television set that says, we are losing our affiliate license with, whatever affiliate, and you will no longer have these shows. Call in and complain.
That's a great analogy.
It's the same thing, right?
It is.
And we have no control over that.
Correct.
So as a consumer of federally funded medical insurance that everybody looks forward to, one, getting to the age of 65, I hope.
Correct.
And then I got my red, white, and blue card. I still remember my mom. Wow, got my red, white, and blue card. Yay!
It is great coverage. Yeah. Your options on Medicare are really great. So it is a good thing for most people. Now, I do have people I meet that are on employer plans where the employer is covering 100%.
Yeah,
or
so
nearly,
that's a great plan.
Right?
Yeah.
So they've been spoiled probably for a long time.
Now they're going to have a little sticker shock.
Right.
Yeah.
But in most cases, it is very comprehensive coverage for a very affordable amount compared to what they're used to. Like the under 65 market in Washington on the health plan finder.
Yeah.
Those premiums are going up in excess of 20% average each year. So this is very affordable and it is great coverage either way that you go, as long as you have a professional help you navigate it.
Yeah, because even in this conversation, there's so many different ways to go.
Yes.
I'll just share a little personal vignette with you. I was pretty set on original Medicare. And, I have a financial background. And so I ran the numbers. And that's exactly what I was going to do. And then I met with my Medicare representative, and I said, this is what I want to enroll with. But in the meantime, because I did get a head start for once in my life, I was ahead of the curve. Just because I know things can creep up. And there was an event in my life, and I had to go on a medication. It's an expensive medication. It was going to cost me $600 a month. And then that's when I really started analyzing just for that one medication, which I need to have.
Right.
So hopefully I won't need to have it forever, but for right now, I need that. And so, in the meantime, I've had surgery and blah, blah, blah. And, so I'm just saying that. I'm just sharing that with the audience because life happens. I'm not very old, but life happens. And we think we're just going to, sail into the sunset of retirement and just remain healthy like we were when we were in our teen years and, and hopefully in our 30s and 40s. And that's just not the case, right? Chronic diseases and just life catches up. It's like grandpa going, oh, yeah, I used to run track, but, I got an old track injury or football injury is really creeping in there.
Right.
Because it does creep in there. And then you're dealing with arthritis and these different things. So the medications, right? So super important.
Which are not going down in cost.
They're not going down in cost. I thought we just, because, I know our friends to the north have cheaper medications and our friends to the south have cheaper medications.
The U.S. foots the bill for research and development.
What does that mean to me?
I don't care. A higher cost medication when you live in the U.S. or buy it in the U.S.
But why can somebody why do we have to foot the bill for somebody who doesn't live in our country?
I agree.
Okay. So did I say that right?
Yes.
So in the U.S., we do all the research and development, right? The testing, right? The development part. And then we do all the marketing. And then so people who live to our south and to our north buy the medications for whatever, cheaper price. But here, we're paying for all that research and development.
That's passed on to the U.S. consumer.
It's passed through to the U.S. consumer. I just love talking about healthcare. Okay. All right. So, wow, I just got a bunch of questions. Do you mind if I keep going? No,
right
keep
ahead.
going?
Yeah.
Okay. So we mentioned just some of the questions that I run into all the time. Does Medicare pay for my stay in a nursing home?
No.
Why not?
So you have to be careful of the term, right? Nursing home, skilled nursing facility, convalescent home, right? Those are all terms you hear thrown out there.
Yeah.
So the nursing home might be a term that someone uses when referring to a skilled nursing facility. So the example would be, I'm in the hospital showing signs of improvement, but not well enough to go home. I would be put in a skilled nursing facility, in which I'm showing signs of improvement until I am sent home, at which point, if the doctor deems I am not well enough to travel for medical care, then the medical care comes to me. All these things based on prior authorization, of course. But that's kind of like the stair-stepping. But nursing home care, convalescent home care, long-term care, those are not covered by Medicare.
Okay. But what's prior authorization?
It is where the example would be moving from hospitals to skilled nursing. The doctor is going to submit to the insurance company, if it's an Advantage plan, a request for prior authorization.
So Advantage plan is a Part C plan. So that private insurance company who is part of the
law now, it was changed a few years ago. So now prior authorization for skilled nursing is the attending physician, the facility that you're moving to, and the insurance carrier. So there are 3 decision makers in there. It used to just be the private insurance company.
So if 2 vote yes and 1 votes no, is that how it works?
No, they all have to be on the same page.
It has to be unanimous.
Correct. So then you step into the appeal process. But
well, if I'm in the insurance company, this is not, it's a private company.
Yes.
So they're going to protect their their revenue stream, right?
Which is why I really like the change in the law, where the facility and the attending physician
have a say.
Yes.
Because before it was just kind of mono decision maker, right?
Correct.
Just the insurance company.
Yes.
Yeah. And it's not that insurance companies are bad. They're actually very necessary.
Well,
we need to have them.
Centers for Medicare and Medicaid regulates all of this.
Okay.
And when they changed the rule, they saw that prior authorization for skilled nursing facilities and for MRIs, the denials were too high. They saw that there was a need to step in and implement some regulation to mitigate that. So CMS is constantly watching all things.
Kind of monitoring this.
Yes.
Yeah. Okay. So we have that. So we need prior authorization. Now, do we need prior authorization under original Medicare?
There are no prior authorizations.
Okay, so that's easier.
And no referrals.
That's easier.
They tried a pilot program in 6 states, Washington was included, that would implement 17 items that needed prior authorization. That went into effect this year.
Is this for original Medicare?
Correct.
Okay.
But they rescinded it. So it's pulled back, it's on hold. There are no prior authorizations with original Medicare.
So if I'm on original Medicare and I'm thinking I need knee surgery.
It's so simple because if it's medically necessary, it's covered.
And what does the term medically necessary mean? Those are 2 big words.
Correct.
And they're very powerful words.
Yes.
It doesn't sound like it.
There has to be medical documentation, and there's steps that they have to go through, right? So maybe there's some PT that's done first, right? They're not just going to cut on you.
Yes.
There's steps that have to be followed, and once that protocol is followed, then that, if that did not.
And I'm all in favor of the federal government monitoring the spending, right? And doing it prudently. And me as the consumer and the person that maybe has this affliction needs to go through the lower phase. Maybe that's some injections, maybe that's some therapy, because therapy can strengthen and get you back in balance and do a lot of things. And preventing fraud. Yeah. So I'm okay with all that.
Yeah.
But then if I really need to have surgery, my surgeon's going to take original Medicare, no prior authorization.
Correct.
Right? And then they're going to send me home. I'm going to go home on home health. No prior authorization.
Prior authorization, not with original Medicare.
No,
correct.
I'm just talking about original.
Doctor says it's
I'm doing the
necessary.
side-by-side comparison a little bit here in the space.
Yes.
Over here.
Yes.
Original Medicare, Part C. Part C. We'll do the C for C, okay? And C for cat, right? or company. And I always use that with my clients. C for company. It's like private.
Yes.
And so to me, that might be really appealing, which I'm going to, again, share with the audience. I do need knee surgery, which is why I was going to go with original Medicare, because I knew that the gates would be wide open, right? I wouldn't have any pushback. I didn't need any prior authorizations. I'm just going through. Then I had another medical issue and went on this medication. And in looking at all that, and it changed my mind.
Yes.
Yeah. So why it's important. Retirement is an active lifestyle. And we have to stay up on these things because our bodies change, our minds change, nutrition requirements change, right? So, yeah. So if I'm on the Part C plan, which I've been really happy with, because my medications, where I was going to pay that $600,
were more affordable.
well, I'm paying like $12.
Yes.
Yeah. So, and then I'm not paying the the out of pocket for the D plan or
Correct.
that kind of thing. So because I'm still working, and I signed up for Part B. So, how I tell the audience how I have to pay that. It's not that much fun.
Oh, so if you're not collecting Social Security,
I'm
and
not
they would
collecting Social
automatically
Security.
take it out of your Social Security,
Yeah.
then they will bill you quarterly.
Yes.
Which, when you get that first bill, it's kind of a gasping moment.
It's like,
Yes.
wait a minute.
They didn't tell me it was going to be this much.
Yeah.
So you can go create yourself a Medicare.gov account. Mm-hmm. You can pay it online.
Okay.
You can pay it with a credit card. A lot of my clients like that because they get their mileage or their points.
Yeah.
You can set up what they call Easy Pay, where they will pull it monthly out of your checking.
Okay.
So you have some other options.
Some other
there.
options.
Yes.
If you're not drawing Social Security,
Correct.
it's not coming out automatically.
Yeah.
Okay. And then what kind of raise am I going to see in that Part B premium every year?
So it's
Or
never
increase.
it's
not
never
a
going to
raise,
be
it's
more
an
than your
increase.
COLA, your cost of living increase.
Okay.
So you are going to get a COLA in your Social Security,
I'm not collecting Social
Right.
Security.
but
Okay.
for those people that are, because they say that they give me the cost of living increase, but then they take it away in my Part B. But it's never going to be that much. So it just depends. We don't know until usually by November 1st of each year what the next year's premium is going to be. Yeah.
Okay. So some of the red flags I see for people just to be aware of. A couple things. You really have to manage your health care plan at least two times a year, right? And the reason is whether if you're not on original Medicare, which I think we've gone through the features and benefits of that, and I've decided Part C, the corporate or the company plan is the best thing for me because it comes with A, comes with B, comes with D, everything all in one.
Right.
Right? But what I have to do because of that, so here's the but from my standpoint. The but is I may not have the same doctor because my doctor may decide at some point after I've already signed up during the enrollment period of October 15th to December 7th to not renew their contract. Correct? Mm-hmm. The hospital system may decide they're not going to take my...
Correct.
And then my option, so I have to be aware of that.
Yes.
And I have to be ahead of that. And the other thing too, because when I worked in the home health space, it was a nightmare on January 1st because we see people, all the time. And so we would convert and I would start in our morning meetings every week. Okay, it's November. You have to talk to your patients about their Medicare coverage. Are they staying on the same plan? If they're not staying on the same plan, so we developed a sheet that says if you're moving plans, please let us know what plan you move, because my company may not have been contracted with that plan.
Correct.
And so then they get mad because their knee froze up because we're only 10 days into rehab.
Right.
Because everybody likes to do it around Christmas.
Yes.
So, right? The rush, the holiday rush between Thanksgiving and Christmas. And then, home health works on a 60-day certification period where, you're in there a couple times a week for up to 60 days and then have to reapply. But it's just so important to really take charge of your own business and just, as we say, age right. And aging right is always being in touch and in charge and knowledgeable about what's going on so you can make the best decisions for you. I think that's what you're saying also, right?
Yeah.
Okay, so then walk me through, you're obviously biased, but walk me through how I should, one, choose my Medicare person that's going to advocate for me. So my Medicare advocate, which we call in this business an aging advisor. Mm-hmm. So how am I going to choose my aging advisor who's a Medicare specialist? What questions should I be asking them when I come in? They're going to ask me a bunch of questions, but really, what should I be asking them as well?
Correct. So I don't think it's your job to ask the questions necessarily, but you really need to be ready with your own information and know what's important to you.
Okay.
When we sit down with clients, they aren't always prepared. And that makes it difficult for us to make sure that we're targeting all of the needs.
Okay.
So what medications do you take? Bring us an updated list or a list that you printed off from my chart or something like that.
Okay.
Or bring the bottles in, right? Yeah. We need the name, the dosage, the frequency.
The bag of bottles.
Right.
I love that. Yeah.
A lot of people carry around the business cards for their doctors. That's perfect because we not only need the name, we need the group, we need the location. So
why the location?
It's because some doctors work in multiple locations and the contracts can be specific to location.
And how do they know the location? By zip code?
By where they go to see their doctor.
Okay.
Yeah.
Okay.
Yeah. So we just, all the information, we compliantly, because of the rules that Centers for Medicare and Medicaid has for us, we have to go through certain information. So it isn't a quick meeting where we're just going to target specific needs that you have. We're going to give you the whole foundation.
Yeah.
How does original Medicare work? We have tools, so maybe it's a little bit easier to follow than just a conversation.
Yeah.
How does original Medicare work? What are your options? Your supplement or Medigap, your standalone drug plan, your Medicare Advantage plan. When we narrow that down of what plan we're looking at for you, then we go through the entire summary of benefits with you. What is the premium, the deductible, the copays? What does each situation look like cost-wise for you? If you're taking an ambulance ride, if you're walking into urgent care, if you're in the hospital for 3 days.
So you're doing the what if.
All of that.
Okay.
We're going to supply you with that document, either paper or electronic, so you have your own copy, and then we're a phone call away.
Okay.
Yes.
What I'm hearing from you is the best way I can get the best knowledge and service from my Medicare advocate, aging advisor, Medicare specialist, is by having my stuff detailed out.
Ready.
And my stuff is anything medical.
Yes.
For what I'm doing today, my medications, my treatments, whatever I'm going through, and what I might be going through in the future. For example, that thing that I took care of that had my prescription, I've been dealing with that for 6 years. Mm-hmm. Okay? But now it just, we call it an exacerbation, okay? Or an inflamed, let's just say that.
Yeah.
And so now I'm having to kind of readjust, but I'd been living with it for 6 years, no problem. Well, problem, but manageable, right?
Right.
So now it's changed. So I need to let you know that so we can see what kind of medications I might have to be on for that.
We send out an annual review form, and when you're filling that out and sending it back, there's a line item in there for any special needs or concerns.
Okay.
So if you wrote in there, I'm going to have a knee replacement next year, when I'm doing your review, I'm paying attention to that physical therapy copay.
Yeah.
Because if I can mitigate $30 a session in cost or something like that, then we're going to look at that.
Okay. So the better I am about being planned and having my documentation in order, the more time you and I can spend on just me and my lifestyle.
Right.
Right?
Right.
And who I am.
And what are you comfortable with? Because when it comes to insurance, you have premium and protection. We don't want you paying so much in premium that it's negatively impacting your lifestyle when maybe there's a better option for you.
Yeah.
So we're going to look at those things, and people are very different in their comfort level.
Yeah.
And some people are high utilizers. I'm seeing 3 specialists a month, or I barely go to the doctor once a year.
Yeah.
So we're going to look at that.
Look at that.
Yes.
Yeah. And that's what I mean. I mean, you're going to tailor it to my lifestyle.
Yes. Do you travel? Do you need to be able to see providers outside of your service area? Is that important to you?
Yeah, because what if I get a plan and I do travel,
Right.
and then I'm not covered, right?
We need to make sure that we're looking at those types of things.
So if I want to go on a cruise, up some river system in Europe, but how do you know? I mean, do you guys know that?
Yes.
Okay.
Yeah.
So
we can tell you what the foreign travel coverage is on any of the plans.
Okay. Yeah. Good to know. Yeah. Well, I was kind of curious because we mentioned, where our information comes from, right? And a lot of it comes from television commercials.
Unfortunately.
Okay. Yeah. So I am a huge fan, not a fan, but I'm a proponent, and I always like to look my person in the eye that I'm dealing with. Whoever is advising me on whatever I'm doing. If it's a home improvement project, you and I were talking about contractors earlier. I like to look them in the eye and get a read on them. If it's, we all go to our favorite coffee shop because we know that person. We've built a relationship with them.
Right.
It's hard to build a relationship with someone on the television. It might be easy and sound like, it's too much for me to get out of my house. That's the other thing. Do you travel to people's homes if they're kind of homebound or not able to get out? Can you do that or not?
Yes.
Okay.
And one of the beautiful things about having a large team of agents is demographically we can suit you wherever you live.
Uh-huh.
If you want in-home appointment, if you want to come to the office, virtual, phone. COVID did give us some things
challenges.
in that way. Well, it gave us the tools to be able to do it over the phone and remotely and digitally and all those things. We as a team 100% prefer the in-person, the relationship building, the trust.
Yeah.
That is super rewarding for us.
Because if we like each other, it is the trust. It builds that relationship. Every year, if you're on Medicare, you're thinking about Medicare, you get one of these. Mm-hmm. So this is the 2026 model. And it explains everything you and I just went over. And I went through it, and that's where my confusion started.
Correct.
I got the first few things, and they were pretty simple, but then as they started applying.
It doesn't get into the weeds. It doesn't talk to you about networks, requirements.
Well, it doesn't talk to me about me. I have to figure out my own stuff, and that's why we have, people that go to therapy, so somebody else can give them a reflection, right?
Yes.
Because when we're trying to diagnose me, so when you're doing things, reading your own manual and trying to do it without having the conversation, there's no critical thinking there. There's no one that's probing and asking you questions about your lifestyle. And, right.
I equate it to, I have a wonderful financial advisor, and I'm an information person.
Uh-huh.
So I need as much information as I can get, but I know when I start to get to here, I trust him. He knows my tolerances. He knows my goals, and he can advocate for me and step in and guide me.
Yeah.
So I think that's what's important is you should have all the information you need, but you should also have a person that you can trust and rely on, or pick up the phone and talk to about your situation. Yeah.
I know it's just sometimes we get stuck in making a decision, right?
Correct.
Because we don't know, we vacillate, we go back and forth. And there's been studies about people, humans that do that.
Analysis paralysis.
Paralysis. So it's nice to have an advisor say, hey, we have this relationship. I know you. You do this, I'm sure you'll be happy. If you're not, there's ways that we can work around. We can do a workaround.
And even if you're established on Medicare and you're on a plan and you think it's working fine for you, I still highly recommend that you have an advisor.
Yeah.
Because the plans change every year.
Yeah.
But maybe we meet and sit down and we look at everything, and I determine that the plan you're on is the exact plan you should be on, and I'm going to tell you that.
Yeah.
And, at least you have someone advising you that knows all the changes.
Why would you take somebody that's an expert and spends, we're filming this during the summer months, and spend the summer months being educated and then not use that resource.
Right.
Right?
Right.
I mean, that's just,
Yeah.
I don't want to use the producer will get mad at me if I use the term that's coming to mind, but it's something we should take advantage of,
Yes,
right?
absolutely.
Yeah.
No cost.
There's no downside.
Yeah, and it's a professional.
Yeah.
And I can tell you every single one of the agents on my team love what we do.
Yeah.
Like, I joked with you on the phone, and when you said, well, I'm going to ask the questions and you're going to do the most of the talking, are you okay with that? And the joke is, don't ask me about Medicare because you won't shut me up. Like, I love it. So, yeah.
Yeah. Well, so you found your calling, you did real estate, but you love this.
Yes.
And it's because of the people aspect.
It's the relationships that you get to build with the clients.
Yeah, that's
Absolutely.
special, isn't it?
Yeah.
Anything that's why I always give a shout out to anybody that's doing, working with the people who are 65 and over and retired, or the kids of those people. It really is a calling. Unfortunately, I was reading an article yesterday about people like ourselves who are in the service industry. Mm-hmm. Burnout's kind of high because working with people is a bit messy, but it's so rewarding.
Yes.
As well, right?
It is. So, absolutely.
Okay, so when we talked initially to prep for this, I said, you will do most of the talking and we'll be asking, but at the end I will say, is there anything I missed that you feel is really important?
We'd be here for way too long if I talked about all of it.
Okay.
I just think that people need to understand the requirements, the penalties, the timelines, to make sure all of those things are in place, so that you're not missing an opportunity to get on a style plan that you want to be on, guaranteed issue. There's also things that will happen where you'll have a particular Part C Medicare Advantage plan that will exit the market at the end of a calendar year. Mm-hmm. It's called a service area reduction. That plan goes away.
Yeah.
If you don't have an advisor helping you and you're not reading all of your mail, you aren't going to know that. And you have just a certain timeline to get on a plan. Otherwise, again, you'll find yourself with just original Medicare, accruing a penalty for not having drug coverage, having that 20% exposure.
Yeah.
So I can tell you when there's a service area reduction, for any of our clients, we are picking up the phone and calling you.
Yeah.
And we might have to call you a half a dozen times until you get back to us, but we're making sure that you're being
And this is a real deal. This is not a scare tactic.
No,
because there's a,
Yes.
Yeah.
We've had several regional Advantage plans leave our market in the last 4 years.
Yeah.
So
well,
it's a real thing.
Because I'm a professional advocate for folks and I'm having to deal with this all the time, and it's getting trickier.
Yes.
And this week, I've had to fill out the address thing about where a client lives for that reason.
Yes.
Is she in the coverage area? And initially they denied her because we said she moved and we notified. And they're like, well, she's out of the coverage area. I said, she moved 3 blocks away.
Right.
And so I had to go through this whole thing. And then here we are again. I'm doing the same thing. It's like they lost it, right? Mm-hmm. So you just have to be very patient. And that's the other thing when we're dealing with just aging in general. We get all this mail. You mentioned mail. And I used to just be a thrower awayer. Like I toss it in the circular file. But now I'm opening everything.
Yes.
Just because I open all my clients' mail, I see that it looks like junk mail or I'm being solicited, but there's some information in there that I need to respond to, and it usually has a time frame attached to it.
Yes. Yeah.
So as much as I
throw away their Medicare cards all the time because they come in such a nondescript envelope.
Well, okay, I almost did that. It is nondescript, but it's nondescript for your protection.
Correct.
Right?
Yeah.
But no one tells you that.
Right.
We're telling you that
Yeah.
here at the Voice of Aging. Your Medicare red, white, and blue card is going to be nondescript envelope. Don't throw it away. You're not even going to recognize it like that's junk mail. It is not junk mail.
Right.
It's your badge of honor. That's what I'm going to say. It's your badge of honor.
Yeah.
You made it. Milestone.
You earned it.
You've earned it. So, well, I just want to say thank you. This has been very enlightening. A little bit confusing. There's just so much going on. But as I was getting prepared for this podcast and meeting you in person, I was sitting there thinking, this is complicated stuff, right? And how can I relate to the audience what it's like? Because it seems simple when you grab this and you look at it and everything's in there. You were mentioning the dates and the things that you need to know. And I'm like, it's all right there.
Right.
But it's like the first day, back to school and you're getting new information. And
how would you retain it?
How you retain it. Yeah. I mean, I'm a textbook guy. When I went to school, you didn't have an iPad and did everything on an iPad. I had textbooks, and I would go through and highlight.
Yes.
And reread it, and then take notes on the important things. And then I would like to hear it. And kind of hearing really solidified, because we all learn differently. Like some people can hear it.
Correct.
And they're good. And some people can read it once, and they're good. But I'm a seeing, thinking, and hearing kind of person. So it's just really important for me to leverage the relationship with my Medicare agent and to hear it, because I can read it and it makes a little bit of sense, but the application of that, how it applies, and really the nuances, I'm going to say nuances to it, you just don't get from reading. You don't get it from a commercial. You don't get it from reading. You don't get it from a 5-minute YouTube video, right? Somebody.
And it's not just your seniors, it's their children. So I have a lot of people that I work with that are the power of attorney for their parents or their loved ones, and they're having to handle their job, their families, and this.
Yeah.
So having someone a professional to work with to guide you through is imperative, because I'm working with one gentleman that came to me and his mom's policy lapsed. She moved from assisted living into memory care. Nothing was getting handled, and by the time it landed on his plate, we have some messes to figure out and clean up. Yeah. Not something you want to do on your own.
No, and it may not end the way that they want, but I mean, this is the other thing is just the education for we call it the sandwich generation, because they're sandwiched between their own working careers and their children, and maybe their own grandchildren, and then their parents, and we're all living longer. The average age now is we just had a client engagement yesterday, and the gentleman, his mom's 91, and I said, well, let me look at her life expectancy. He's like, well, I got it's for insurance purposes actually, and so we looked at it. I said 4.4 years according to Social Security. He's like, what? I'm like, yeah. 4.4 years, because she's attained the age of 91. So that's what they look at, the historical actuarial tables of people who have attained the age of 91, and they're female and they're blah, blah, blah.
Right.
And so it's shocking, because we've gone from the average life expectancy of 45 to, the high 60s to the high 70s. And we've done a lot of that in my lifetime.
Right.
Right? So medical.
And you have the whole aspect of dementia and Alzheimer's and the memory care situation where those families are having to step in to help. To help with mom and dad. Yeah.
Dawn, this has been fascinating.
It's been great.
You're very well. I just knew how much you study and you learn. It's been great having you. You've been great to the audience, because your answers are very succinct. They're very clear and easy to understand. So.
And that is
you're a master of your craft.
Navigating, right? And that is the very thing you do with the client. Yeah. Is navigate.
Yeah. So we did a little of that for him so they could see how it works.
Yeah.
That's great. So I think the takeaway from today's Voice of Aging podcast is don't be afraid to contact a local agent that can walk you through and navigate with you, walk alongside you and support you, and answer all your questions. You're not paying anything for that service. So why wouldn't you? Right?
Yes, absolutely.
So again, thank you very much, Dawn Cherry, here in the Pacific Northwest. And obviously 30 states you have clients, so you have a long reach, and that's great. They obviously like you, and you obviously like them if you're going to get licensed in that many states. So that's it for this edition of The Voice of Aging. Again, you can find us on Spotify and YouTube. And thank you very much to Dawn for coming in today and talking all things Medicare. Thanks for listening to The Voice of Aging. Like, share, and explore our services at agingsolutionsnw.com. And connect with us on social for more support.